It's the
Hello,
Infant Feeding team. Here we are, JR, room
Thursday
7.
again, absolutely. And this is the Infant Feeding team at the JR. I'm Naomi, and this is Alex, my colleague. And we are part of the Infant Feeding team and work in Oxford at the JR and in the north of the county and around in Oxfordshire with breastfeeding support. So today we're doing a session of questions and answers, and if you have got questions about breastfeeding or giving bottles or any form of infant feeding, this is the right forum to discuss with us. If you have any other issues, so about your induction or your scans or your pregnancy, please divert those questions to a different session where there is an Ask the Midwife opportunity, which there are several each week, where you can discuss those things, but you can also contact your midwives as well and ask those questions. We are midwives, but we don't work in all of the areas anymore. We just work in a smaller field, so we don't know all the right answers straight away. It filters down to us, but we don't know them straight away sometimes. So we're probably not the most helpful people to answer those questions appropriately, and we'd hate to say something incorrectly for you. So just questions on infant feeding today, if that's all right.
Okay, so you've got 16 people watching already. Welcome. Nice to see you all there. So we're marking Black Breastfeeding Week this week. It's the third time it's been celebrated in the UK. It's been running in the States for about 8 years, and I think it's just marking that we have to be aware that there are other hurdles that some mothers, maybe of colour, would be having with regard to maybe accessing healthcare, cultural sort of perceptions of what they should be doing or shouldn't be doing. And we all have our challenges with feeding, but these could be sometimes added challenges. And we're aware as a team that we need to be on the lookout for the wording that we use, for instance. So, for instance, we often say to a mother that if she's got thrush, if you read about it, they talk about pink nipples. Well, that's totally inappropriate for a mother who doesn't have pink nipples. Or a red breast if she's got mastitis, and again that's totally inappropriate if she doesn't have breasts that would show if it's red or not. So it's being aware, as within our teams, within our colleagues as well on the wards, of the language that we use, and to make sure that we are inclusive with the women that we're dealing with. And it's just being able to see that mastitis is there regardless of whether it's red or not. We can look for other signs, and being aware of jaundice in a baby with parents of any sort of origin, that it may not show as what we would see in a Caucasian baby that would come across as a bit yellow, but is less obvious maybe in other babies, but looking for other signs. So it's being aware from us as a healthcare team to be inclusive, but also being embracing all the mothers that are having babies and helping them to get the journey that they're hoping for. So we have a fabulous array of pictures that we've put up today, things straight from all the other stuff we use, just brought together, but just to mark this day, this week of this Black Breastfeeding Week. So we're there. So I can see we've got a few comments coming up already. So Nikki's come up and she said hi to both of us. Just want to say a massive thanks to you and the team at Chippy for all your help with Felix. He regained birth weight within 3 days, and he's feeding well. Now I'm looking to see, because I can see the comment on my phone, but I can't see it on the computer. It's not coming up on there, so I'm going to have to just tap it and get the rest of. There's Claire as well. She's come up as well. So I'm going to reset my laptop. So in the meantime, Naomi, do you have something else you wanted to talk about?
Yeah,
today?
I did today actually. I just thought. I was reading something, good old Facebook, here we are, and things come up and down all the time. It's a really good way of connecting with lots of other people and lots of other services in breastfeeding throughout the world. And one of the things that I read about, and that mothers talk to us about every day, we get phone calls about it, is how do you break the cycle of topping up and supplementing your baby, whether it's with bottles of breast milk or whether you're giving your baby formula, because at some point in the early days your baby wasn't gaining enough weight perhaps, or you didn't feel that there was enough milk for your baby, and you felt compelled, maybe a member of your family pressurized you to give your baby a bottle to help you settle and sleep, to think that they were helping you to get more rest and recover. Or medically, maybe your baby needed to have extra fluids in the initial few days, maybe it was in the neonatal unit, or it was readmitted for postnatal weight loss. And you get down this cycle of either triple feeding, so you're feeding your baby at the breast, giving a bottle and then pumping, or just topping your baby up with your milk that you've expressed or that you've got saved in the freezer, maybe, that you've just decided that you want to give yourself a little bit more time, and you're giving yourself your baby's bottles, that or you're giving formula. That how do you get that cycle away? Because you gain confidence as a mother as you go down your journey. Once you've got your baby and you're feeling that every day you're learning a little bit more, how do you break that cycle? You know, what's the best thing to do to get yourself back onto exclusive breastfeeding? And I think many women worry about this, because the problem with the cycle is that you give your baby a bottle, and so the baby sleeps for longer, and then they breastfeed for less, and then they breastfeed less because they're not getting so much food, and you drop feeds, and then they become dependent on your supply drops, and then you end up on that cycle where you've got to keep going. So it's about how do you do that? And it's weaning your baby back onto the breast and getting being confident as a mother. Now your baby will wean itself back onto the breast probably a lot quicker than you will wean yourself off giving bottles as a family. And that's the problem a lot of the time, is that you have been so frightened by healthcare professionals telling you your baby is starving and or dehydrated and or needs more food because the scales aren't going up. And indeed we do focus a lot in the early days on baby's weight, and that creates a huge amount of anxiety, and has done massively in COVID, because you haven't had access to scales or healthcare or drop-ins or normal contact with normal everyday mum conversations with other mums with babies. And so you feel that, how do you get out of that, and how do you trust your instincts on breastfeeding? So I think the first thing is that you look at the 4 reliable signs again, and that, I don't know how many times we've talked, this is about our 18th session, I think, 19th session that we've done on Facebook now, so it's a lot of weeks. And we talk about this every week, I think, about the 4 reliable signs of milk transfer. So I'm hoping that all of you will be able to do this in your sleep now. But for those of you that haven't done it before and talked about the 4 reliable signs of milk transfer, the first one is that your baby is suckling and swallowing. And I think that you have to look at the way that your baby is transferring the milk from the breast into his tummy. And that's the lovely big deep glugging, the deep swallow, suckling, swallowing, not the chomp, 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 chomp that babies do when they're not getting large volumes of milk. And looking at the pattern when they go on the breast, that starts from little flutters to deep glugging, and then you hear that noise where they're swallowing. And that might be every suckle or every other suckle, and that might be that you're feeling that your baby's getting lots of milk, and you might see his eyebrows going up and his eyes opening, and he's saying, "Oh, this is good, I'm getting lots of milk." Or he may not be doing that. He may be just getting the right amount, not too much, or he might not quite be getting enough, and that's where you've got yourself into the situation that you've been in. So you look at the suckling and the swallowing, and if your baby's doing that reasonably, and there's lots of movement in the jaw, and you see big full cheeks, and he's engaged with you, so his eyes are open when he's swallowing, that means there's flow going into his mouth, he's getting food. And if you watch when you're giving your bottles to your baby, they will do the same, because they're getting flow. So think about, if you have been giving bottles, what did he look like when he was getting food from the bottle? Does he look like that? Awake, alert, eyes open, swallowing deeply and glugging and hearing that swallow when he's on the breast. That's the first reliable sign. So look at that, see how that is with you and your baby. And then the next one is peeing, and 6 pees a day after day 5, and nice clear, not heavily smelling, concentrated pees without any urates in them. And then pooing, so two poos a day, and that's sort of scrambled eggy, curdled yellow, bright yellow. They shouldn't be green or brown, and they shouldn't be absent. So that tells you if there's milk going in, it will be coming out. Yeah. So if there's enough milk going in, there will be enough milk going out. And then the very last one is weight, and you've got to look for those signs to be reliable, that your baby is transferring. And the other thing is that you may well want to just top your baby up a little bit, so you will offer a little bit more, and he might start refusing it. And that's the first sign that he's getting enough. The other thing that you could do is challenge the top-ups. So you might say in the morning you've got more milk in your breast, you're quite full. Do a breastfeed and see how long he will go for before he wakes up again. And then if he wakes up in an hour or an hour and a half or 2 hours, you think, well, maybe he isn't quite getting enough yet, or he's used to larger volumes and he's got to adapt to it. So breastfeed him again then, and then maybe top him up after that feed. And then again challenge it again a bit later. But as the day goes on, your supply you probably feel is a bit less in the particularly in the first few months, that you don't have quite the same quantity in your breast in the evening as in the morning. So the first thing is to challenge it in the mornings when you probably are fuller, and quite often at night your baby doesn't want top-ups in the same way. They're often more settled and sleepy at night after a couple of weeks, not initially. So try those things first, and that is a way of reducing them as a parent rather than as a baby, because you will wean yourself off the top-ups, and quite often you very reluctant to give the last one in the day, that you want to give one at night thinking that they will sleep more. But it's just a question of seeing what's happening and look and trust your instincts. But the 4 reliable signs are the things that you want to be looking for to see if he's actually getting enough milk. And they will tell you reliably if he is. And then you can start to challenge the top-ups with less volume, maybe not give him as much, or give him one every other feed, then one every second or third feed, and then twice a day, and then once a day. And you can wean them off doing that. And in the same time, you've got to make sure that your supply is maintained. So, you've got to maybe pump a little bit more, just to make sure that you're upping your supply at the same time. Or breastfeed a little bit more with some compressions and switch. So compressing is where you're...
Got questions backing up, Naomi.
Yeah, I know.
Just saying.
I need to finish it though, or I'll get told off for not completing what I was saying by you listening. So squeeze your breast when they're suckling, and then release when they stop, and that will push a little bit more, and that's a bit like giving a top up, and it also is a bit like pumping. So don't fret if you're doing it. Do call your healthcare professionals, your health visitor, your midwives, local breastfeeding support, OBS, baby cafes, NCT breastfeeding support, Latch League. They will all support you in things like that to get your confidence back as a mother, and that's a really important thing, because I think it's something that happens a lot, that babies are topped up very easily because of the lack of confidence on sometimes staff, but often on mums as well, and dads. So it's just a balance really that you have to do, but do it with somebody supporting you if you need it.
I think that it's a thing to say that when mums are having to express and top up, it's never intended that that's the long-term goal. No. The long-term goal is always that the baby goes back to the breast, because in the long run it's a lot easier to be breastfeeding a baby than having to do, as Naomi described it, triple feeding, which is feeding, topping up and expressing. Anyway, let's have a quick look at some of these questions. So thank you for Nikki for her comment. So she was saying that she was just finishing it off because I couldn't see it, but I can see it now, is that she was talking about her baby Felix. He's regained his birth weight within 3 days of having his tongue-tie division, and his latch is a confident and secure one now. Well done, Nikki.
Makes all the difference.
Claire's come on. Claire's another lady we know. Hello both, good to see you again. Her question this week's about weight. My baby boy is now 10 weeks and he's 6.4 kilograms.
Ooh, look at
well,
you.
That's good. He's huge, I'm sure he is. He gains an average of 300 grams per week. That's amazing. At what point should we start to worry about his weight? Is it possible to overfeed him? He is and has always been exclusively breastfed and feeds about 12 times in 24 hours. Any advice or reassurance is appreciated. Thank you. No, just do what you're doing and let him do what he's doing.
Just pat yourself on the back and say you've grown a baby.
Yeah, he'll sort it out. And very often you do get these gorgeous breastfed babies where they have
Michelin men.
Yeah, and you can literally see the elastic bands around their wrists where they're so chunky.
Just wait till he's 9 months.
Yeah, but then they start moving and that all falls off them. So we know that in the long run, babies that are breastfed do tend to have very less problems with obesity. So you're doing the wonderful thing. Let him do what he wants, and that's fantastic.
Don't let anyone tell you otherwise.
No, let him tell you.
Yeah.
So it's responsive breastfeeding is what we're all about. So let's just see. We've got next one's from Jessica. She said her doctor thinks that her breastfed 7-week-old might have cow's milk protein allergy. How long after quitting dairy can I hope to see some improvement in his symptoms? Well, we reckon it takes 2 weeks to get out of the system. So when you've given up cow's milk, just give yourself a good 2 weeks for it to go right out of your system. Be aware as well that a lot of products have cow's milk in them and you don't necessarily notice. Biscuits, for instance, you wouldn't think of it, but lots and lots of biscuits have cow's milk. So just be aware. And even, not that you would probably need to be this extreme, but even some milks have been clarified, some wine has been clarified in milk. Not that you need to worry about that, but it does creep in all sorts of weird and wonderful places. So if you are trying to avoid cow's milk protein allergy, do check the ingredient list on the foods that you're eating.
You might see change after about a week, but little subtle things, but they say 2 weeks clear, and then you might see a change. But it is it is trial and error with it.
No, when you're thinking about a baby and whether it has got cow's milk protein allergy, because it actually is really rare. We hear a lot about it, but it's really rare. You would be anticipating that you're going to have a baby that is perhaps got eczema, has got mucousy or bloody stools, probably being sick.
Quite often a very sore bottom, blistered sore bottom.
So those are the sort of things you're looking for. A baby that is just crying a bit is not necessarily going to be a cow's milk protein allergy. It may be a multitude of other things. So be aware of what actually would be constituting cow's milk protein allergy. There is a lot of chat about it at the moment, but it is actually really quite rare still.
And quite often your baby doesn't gain any weight when it's having feeds. It's really not gaining weight. And then you find and the poos are sort of greeny often, and then when you remove the cow's milk protein from the diet, then you find that the weight gain goes up and the poos start becoming much more yellow, and it is quite sudden that you see it. The weight just goes on and the baby is pooing much more. So it isn't an unsettled baby that is cow's milk protein normally. Occasionally it happens, but it's normally much more subtle than that, and they often under paediatricians because they're not gaining weight, and that's something that they may look at eventually, but it's not usually the first line of treatment.
Sarah's come on to say that her baby's now 12 weeks old and she's been expressing because she's been had trouble latching, but the milk is slowing down, so she's getting 5 ounces every 4 hours even though she's pumping loads. It doesn't seem to be helping her supply, so she's introducing formula and giving it to her baby, 2 bottles of milk, and the rest is formula. So let me get that right. So I'm introducing formula, giving rest is formula. So obviously what the core part of this is you're struggling with your supply. What we'd probably say is actually mix it up a bit. We reckon that actually when you're pumping long term, for those that have to, that actually if you surprise the breast, so you've mentioned that you're doing it every 4 hours, we'd say, well, do some at 1 hour and do some at 2 hours and some at 3 and some at 4, but mix it all up. So if you are working to a rhythm, it's like when people do exercise and they always do the same exercise, you always exercise the same muscles. So actually what you want to do is surprise the breasts and go, okay, well this time I'm going to give you 1 hour. Now it's going to be 2 or whatever. And so mix it up so you can have long periods in the day, shorter periods in the day between the times that you're expressing. And you're always aiming to do a minimum of 8 in the 24 hours. And that's the other thing to say, that obviously if it's a 4 hour gap, that's going to be 6 in the 24 hours. So that may not be helping either. So Sarah, I think we'd suggest being a bit more ad hoc. We'd say frequent, not regular. Do some with big gaps, some with shorter gaps, so the breasts don't become complacent, and that actually that way you'll probably get more milk. We'd also suggest that you are hands-on as much as you can. Cut an old bra up, you may have done this already. Put the kits through the bra, get your hands on the breast. Naomi showed compressions earlier, and that's what you want to be doing at the breast when you're expressing as well. And it's having the baby nearby, getting oxytocin flowing.
Into skin when you're pumping.
Yeah, if you can manage it, but definitely having that baby nearby, smelling the baby's head makes a really big difference because that's really good for oxytocin. But it's also watching the flow, and as the flow slows, have a quick break, glass of water. I've talked about this before. Stretch your arms, start pumping again, and you'll get a bit more. And then when it slows again, same again. Quick break, start the pump again. And you'll get a bit more that time, and that's how you push your supply. If you only pump for the same length of time at the same times, your body won't give you more. But if you really challenge it then you will see that supply going back up again. Your body knows how to make that much. You just need to tell it you need it again. So I would anticipate you'll be able to get your supply back up again.
It might be that your baby was in the neonatal unit in the first few weeks. Sometimes babies that have been in the neonatal unit and you're told to pump 3 hourly sometimes in the early days, and that sometimes you see a dip in the supply at 12 weeks because of that. It's the way, as Alex has said, that you need to surprise them a bit more to just make your fluctuation of your hormone levels change a bit more. And it may well work.
There's a video that you could watch which showing mums who have had babies on special care baby unit. It was Stanford University, as in STAN, Stanford University in America, and it's called Maximising Milk Supply. So if you put Stanford University Maximising Milk Supply into the internet, it will come up. It's a 9-minute video, and it shows mothers being really, really hands-on, working the breasts. We've talked about what the breasts are like. I was describing as florets of broccoli. You've got all these different lobes where the flowers of the broccoli are, and you work the whole thing. You get your hands all over doing those compressions with massage as well. So that may really help, Sarah. So think about frequent, not regular, surprising the breasts, getting your hands on your breasts too, pumping and stopping and pumping and stopping, so that you're not pumping for the same lengths of time at the same frequency each time, and hopefully you'll get a bit more, and you may be able to drop those formula feeds. Then you may have enough milk to just drop them out again and go back to exclusive milk feeding. Charlotte has written her baby girl is now 4 weeks tomorrow, and the poo has gone through correct colours in the initial week, and it's gone now yellow to green, a bit like mushy peas. Is this okay? She's exclusively breastfed. Well, we'd normally think it'd be yellow, wouldn't we? So
sometimes if they suddenly had a bit of a growth spurt and they're suddenly up their feeding, they get a bit more lactose than they've been getting, and that sometimes makes their poos go a bit green if they're not getting as much fat in the feeds because they've stepped up the milk supply. So it might be that your baby's had a bit of a spurt and suddenly you've got an increase in milk. It was a bit warmer a couple of weeks ago, and that might have increased your milk supply a bit. And is the latch deep enough? And we do talk about deep latch all the time. It's always going back to the basics of positioning and attachment.
And I think that's particularly relevant because your baby's now 4 weeks old, and what we find is babies grow. Whereas when you first started, we would have said to you, or all our colleagues would have said to you, nose to nipple. And what happens is the baby doesn't carry on moving over. Mums keep their babies central to them rather than moving them over. So remember, start nose opposite nipple, and then she'll be in the right place, because otherwise she might end up with her mouth central to the nipple now, and actually she's not getting such a good mouthful as she did at the beginning. Naomi's going to show you a picture. So
you see that one there. So that's a lovely big mouthful, and you see how that nipple is just skimming the gum ridge as it's going on, so that it's very asymmetrical, it's not central, and that will allow the baby to milk the breast correctly and get more fat from deep within the breast, rather than over stimulating you to produce lots of full milk, or just the thirst quenching milk. We don't talk about hind and full milk very much now, but it just means that they can milk the breast really well and get the right mix of feed, and that might just be all you need to do in order to change the colour of your baby's poos. If everything else is all right, we don't tend to worry too much, because we normally know that it's just slight feeding changes, and you can tweak that quite well. So use your local services. OBS or Latch are doing support online, and see, or a health visitor, if you have contact with your health visitor, talk to them about it, but also talk to us if you need to.
Right, Kate's contacted us, and I met Kate when she was in. She says she hopes we're both well. We are.
We are.
Naomi had a nice holiday last week. She's forgotten about it now. So she's still on what she could describe as a positive breastfeeding journey, with her son.
That's nice.
And she wanted to ask our advice about pumping. I've never used the breast pump, and he's now 11 weeks old. Have I left it too late to be able to pump? I'm looking to continue breastfeeding for the majority of the time, but looking to express some milk for my other half and family members to be able to feed him every now and then. Is it too late? And if not, how often, how much should I pump? Thanks. So,
well, it's just however you're comfortable. I mean, when do when do you have the most milk in your breast? Is it first thing in the morning? Because you might find after a feed in the morning, when you've got a bit more there, that you can take a little bit off after that feed, and as the day goes, you can take a little bit off over the day rather than draining your breasts and over stimulating them. And you might find that is an easy way to do it. Some people use a hacker, don't they, or a breast reliever. When they drip breast milk, when they feed on one side, they drip breast milk into a little suction thing and collect it that way, and they can get 30, 40, 50, 60 mils at a time sometimes when they're doing that. So you can, it depends on you and what you want to do. I think be careful you don't pump before a feed so that you deprive your baby of what they want. And you might find that your baby sleeps a little bit longer at 12 weeks suddenly, and you might find that you want to, after a couple of hours, might find that you're a bit full if they've had a bit of a growth spurt, which they tend to do at 12 weeks. They tend to be quite busy upping the milk supply. You might find that you've suddenly got loads of milk, and that's a really good time to use that and to collect a little bit more if you need it. But don't go draining your breasts all the time after a breastfeed, because you will find that you replace it if you do it frequently. But if you're just going to use the occasional bottle and you want to collect some, then do it and put it in the freezer, and then it'll be there for you. Bear in mind that drip breast milk won't have as much fat in it often unless it's dripped after a breastfeed, which is unlikely that your breast will do that in the same way. And if you're collecting, and this is for anybody with a hacker or a breast reliever, if you're still learning to breastfeed and you're using it to drip and collect, make sure there's enough milk in your breast for the next side when your baby swaps sides, because if you drip all the milk out before you've fed on that side, often babies don't gain weight in the right way. So be careful that you don't use it all the time when you're breastfeeding, so that you're depriving your baby of having a feed on the other side after it's finished on one side, because people do sometimes get a few problems with that.
But yeah, I think the other thing about it is that if you do leave your partner with a bottle, let's say you escaped the house and you left your partner with a bottle and it had all been the drip milk, then actually, as Naomi mentioned, it's going to have less fat in it, because that's what tends to leak. So the end result is that, but your baby will be looking for food a bit quicker than if it had been a feed at the breast, for instance, where they've got the full balance, or if you'd expressed it where it will get the fattier milk in it. So
perfectly good milk. It's just that it's
slightly less fatty.
Got slightly less fat in it.
It's like giving them a salad and not a main course.
No pudding, no chocolate pudding. And I don't know if you've given bottles before. And whether you're comfortable doing giving bottles. You may be an expert at giving a bottle, but we can run through some responsive bottle feeding at the same time if you like. So I don't know if you can see me here, but we worry about babies being overloaded. So if you tip the bottle up like this, the milk will just drip out, drip out, drip out, drip out. So if you give it to your baby like that, it will drip out into your baby's mouth also very, very quickly, and that can be quite overwhelming. And signs of that being too overwhelming for a baby is often they splutter and choke on the bottle, but also they will look away from you, so their eyes will avert from you and they will look away if you're giving them milk too quickly, or it's not a very positive experience for them, or they're struggling. They won't engage with you. So babies should be engaging with you when you're feeding, and there should be eye contact. So put your baby close. Probably better if I do it like this. We're doing it on our mobile phone again. Hold the bottle at a straight line so that it's not tipped up. You might need to tip it a tiny little bit to make sure that there's enough just in the teat here rather than filling it all up. Run the nipple down your baby's top lip and let them gape and suck the nipple into the teat into their mouth, and then pace the feed so that they suckle and pause. If they can't pause, they will become stressed. If you're doing that, they will become stressed if it's going in far too quickly. So pop the bottle onto its side a little bit more and let the baby pace the feed. Obviously, as the bottle empties, you need to turn it up a little bit to put more in, but just make sure that your baby's sitting up slightly. He's close to you as if you were breastfeeding him, and allow him to pace the feed and spit the teat out when he's had enough. And that's for anybody that's giving formula or anyone that's giving express breast milk in a bottle, that it's the same way, and the same principles, exactly the same for every baby. So just be aware that it's nicer, it's a more positive oral experience for your baby and much less stressful for them and they will take what they want rather than what you want them to have. And that means that you're not overfeeding them, because some of the things are that babies some of the research and the information that you see is that babies can gain more weight if they're fed in that way as opposed to the responsive way. And we do find that mums come back and say that their baby takes less when they top them up when they do it this way. And that's really
nice
important.
for the baby.
It is nice. It's nice, and they pace it themselves, and they're in control. And babies, of all things, like to be in control, and also limit the number of people that give the bottles. So keep that to within, 1, 2, 3 of you in the family. If you've got a family member that's caring with you, a parent or a sister or something looking after you, but limit the number of people that give the bottle, so that it's seen as food, and that person is that in the family as the feeder, and don't pass your baby around to lots of people, particularly in COVID. You shouldn't be having housefuls of people generally. You're not having friends and family around in the same way, but generally we just say stick to the parents to feed, or the carers that are involved.
Right, so hopefully that answers your question, Kate. So you can start pumping and see how you get on, and hopefully it goes well. You know where we are, you know how to get hold of us, so let us know if you need a hand. Right, I know we've got a few more here. Livy's come through. She says, hi both. I'm so pleased to be able to breastfeed and have a good supply. My baby boy is extremely hungry. He's currently only 10 days old and pretty much cluster feeds throughout the day, and even more so at night. We're exhausted and wondered if it's normal for the first month or so to give milk whenever the baby wants, or to try a feeding regime. There's a lovely saying, and I know I've said it before on the on this. It's a UNICEF BFI, and we've mentioned before we're going for BFI accreditation, which is like a standard. It's a bit like the Ofsted of infant feeding, and they will be visiting us in December anyway. And one of the statements made that they use is that I use the breast for comfort. It's a mummy who says this. The nutrition sorts itself out. So yes, at this point in time, you would expect to be feeding very frequently. If you imagine your baby hasn't got the ability to self-soothe, they're trying to understand the world they've been born into, and you are their way of doing it. And they get lots of comfort from being at the breast and not just nutrition. So there's so much going on. So keeping your baby close is a really, really important thing. We often talk about slings. Slings are a really good way of meeting a baby's closeness and comfort, and maybe a sling would help you too. So you could perhaps try that. They don't like going down in cots and prams. They want to be held by you, your partner, grandparents. So having a sling may meet your baby's needs, and that might space the feeds out a bit, but as long as your baby is gaining weight appropriately. What we don't want to do is replace sort of having the baby in a sling with good weight gain. So it should settle down. Lots of people talk about 6 weeks. I can't tell you it's 6 weeks before it settles down, because it's different for everybody, but it will get easier with a bit of time. You're both learning. It's a learned skill, and it will get a bit better.
And they don't know day and night at 10 days. They think nighttime is the time when they feed, and they sleep more in the day. But they are calibrating. That frequent feeding is calibrating for when your baby is 12 weeks old, which we've just talked about, where the supply will dip if they have long gaps between it in the early days. The supply will be secured for when your baby's 12 weeks old, when they really do need milk, lots and lots and lots of milk, when they have a really, lots of growing to do and changes in their development. And so you're securing all of that now, and your prolactin receptors are really being primed beautifully. And the more you're doing that, and you're coping, if you're not sore, hopefully, your attachment is good, and he's just enjoying being with you and enjoying the positive oral experience that he's getting. You have to learn to sleep round the clock, and you have to be very good about going to sleep and turning your phone off and shutting your curtains and taking your clothes off and going to bed and sleeping properly, and do it in shifts with your partner, so that one of you has the baby, the other one has a sleep, rather than trying to sort of kip on the sofa and half hearing your baby. Really make the effort to get undressed and get into bed, and wear earplugs and put an eye patch on, and maybe one of you go out for a walk with the baby in a sling while the other one has a proper sleep where they can actually switch off, because that will give you quality time, and you just sleep round the clock while you've got help at home.
Right, we've got 8 comments behind this one, so we're going to get a move on. So Livy, just finishing off, you mentioned feeding regimes. really and truly what we would recommend is just following the baby, because actually all you're going to do is fight your baby, because your baby's got no idea about feeding regimes. They don't know about, we've already said they don't understand night and day. They just want to be with you and close to you as much as possible. If you can follow your baby, then what you'll notice over time is some gentle rhythms, as the Latch put it, will start to become evident. And over a bit of time, you'll notice that your baby has a way of, it will wake at this sort of time, it will sleep, it will feed at these sort of times, and you will find a way. But if you try and impose a regime onto your baby, they've no idea about it. So it's a bit like the whole thing that, well, the baby didn't read the book. So if you can go with your baby as much as possible, then it will sort itself out in a bit of time. Try and go with your baby. I know it's tough, but it will get easier.
Babies cannot be trained to do anything.
No, they haven't got the brain capacity.
5, 6 months maybe, but you know they don't know any different. That you're their mum, and that's all they're mammals. They just need to be close and cuddled and loved and fed.
Oh, we've got a lovely Becky's contacted us, and she said, good afternoon for these videos. I've been listening and getting some tips for breastfeeding journey. I'm just going to finally meet her boy with fingers crossed tomorrow. Yay. Currently contracting. She's 41 plus 2, and she's watching this, and it's a welcome distraction. Well, congratulations. We look forward to hearing that you've had your baby. You can let us know next week when you've had your baby and everything's gone well, hopefully. We'll be thinking of you, Becky. We all will. So, yeah. Jessica's come through. Thanks, that's interesting. He has lots of gripey pain and diarrhea, but he's piling on the weight, so not so sure. So I think this was we were talking about the cow's milk protein allergy there, weren't we? So possibly not. It might be worth just revisiting positioning and attachment. We're always talking about it. That's why we've got these pictures up, because they are so important. It may just be worth having another look at your positioning and attachment. Make sure you've got it right.
Lactose, which is the thirst quenching milk in the beginning of the feed. If he's on off the breast, lactose has got lots and lots of sugar in it, which makes them gain lots of weight, but it also makes them very gassy, because the lactase in the baby's tummy can't break it down, so they get this byproduct which is really fizzy and gives them tummy ache and very explosive poos, and they cry a lot. And lots of first-time parents get in this trap of the lactase imbalance, where they just get lots and lots and lots and lots and lots of lactose fed, and they just pile on the weight, loads of poo. Everybody says everything looks fine, but neither of you are happy. Okay. And it's just about tweaking the positioning, and it might be that that's what you need to do, and everything will be resolved just by a millimetre of movement with the latch. So look at the deepness of the latch. Is he really gaping wide? Is he going from underneath with his chin against the breast, so that he's getting a really asymmetrical latch?
Got it on here, haven't we?
Got it on here. We've got it on this one. That's a slightly different picture, but can you see that his chin is really underneath and the nipple is skimming over the top gum? And it's about making sure that you get that every time, and then you'll find that he will milk the breast more effectively. Line him up well, tuck him into the contours of your body, and also look at the angle of your breast, the way it's dangling, so that you can see that he's going onto the breast in the correct way. So if your breasts are coming outwards, then your baby should be tummy to mummy, but not tummy to mummy. It should be more tummy to mummy. If your breasts are going downwards like that, then your baby should be looking up at you a lot more, and you should see more of his tummy looking at you. But all the time he should be tucked in close, and just make sure that he's got the opportunity to get that gape asymmetrically, so that he's not in the middle like that. He's like that, and as you get further on into your breastfeeding experience, your nipples get less sore, and they can still be wrong. So just make sure that he's asymmetrical, and he's just skimming over that nipple and not in the middle doing that, because that is not enough fat. That's enough fat where he's right underneath the breast and milking it with his chin and his jaw. Okay, so if you're not sure, revisit and get someone to film you while you're breastfeeding, and see where your breasts are dangling and where he is on your breast, and see if it works, because looking at videos of other people's babies and breasts is not helpful when you've got your own shape. So get someone to video you doing it and see how it looks, and then have a think, and call us if you need to talk it through, or OBS will do it, Latch. They will all be able to support you as well, and if Health Vistas midwives as well.
So good luck with that, Jessica. I hope it gets a bit better. So Alejandra's come on. She says hello both. She's taking some antibiotics and her baby's been very fussy, doesn't want to be left on his own, doesn't enjoy his gym or bounce anymore, crying most of the time when I'm not carrying him, and he's not drinking as much milk as before and has started to spit milk very often, which didn't happen before. He's had his jabs last week. Is this behaviour because of the antibiotics? You tend to really just see that you get greeny stools when mums are on antibiotics. So that's
what. Presuming he's 8 weeks if he's just had his first ones.
Yeah, so
it might be that it's the rotavirus makes him a bit nausea, sort of nausea and sicky and a bit under the weather for a little while. Some people find that makes their babies feel a bit. But talk to your health visitor about it more. I think that it just might be the knock-on effect of the immunisations, and he should settle down.
Yeah, sounds more like that than your antibiotics. But babies don't tend to manifest like that. What you do see is green stools if mum's on antibiotics, but not everything else you're describing. Sounds much more likely it's the vaccinations. But as Naomi says, have a chat with your health visitor. Good luck with that, Alejandra. Kate's come back. Thanks very much for the bottle demonstration. She liked your demo.
Good.
So they're feeling very confident on the breast. But she's yet to try the bottle. Good luck. You might find it might be better it's not you, Kate, because to be honest, your baby's going to be looking for the breast. So maybe try your partner or a member of the family and see how you get on. And perhaps try when he's not desperately hungry, because he's going to be looking for the food and he thinks food comes from you and you only, which is lovely. It's a compliment to you, but maybe try in between feeds when he gets an idea of this thing in his mouth and the milk comes out of it, and build up to it. So don't expect him to just down a feed in one go on the first occasion. Alejandra's baby's 2 months old, so that would be about right, wouldn't it? Yeah, fits in. Christina's come back. How can we tell the difference between cluster feeding and nibbling? How can we tell when they're nibbling? Thank you. That's one of your words, nibbling.
So nibbling is where they're not effectively, so we would call it non-nutritively feeding. So they're actually doing not very much at the breast or suckling and swallowing, and we talked about the suckling and swallowing as the first reliable sign. So if they're not doing nice big deep glugs and swallowing, that sort of noise, it's more chomp, 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 chomp. That's much more nibbling or just fluttering at the breast a little bit and not actually swallowing. And that's what we would call nibbling. It's not effectively feeding. And some babies do that just for comfort and they've had a good feed and they just like to be there. But others do that because they can't feed any other way, or the flow in your breast is very low and they're not getting enough food. So it depends on your problem, but that's the difference between good suckling and swallowing and nibbling and not suckling and swallowing. And they don't put on, these babies tend not to put on weight, and they tend to be all the time at the breast and frequently feeding, and you often have low supply as a mum. So it's obvious if it is there. You would know that he was probably nibbling rather than suckling and swallowing. If you and you can look online at, if you put into YouTube good suckling and swallowing of a baby, a newborn baby or a month-old baby, it will show images of babies glugging and swallowing at the breast, so you can look at that and really see it and compare what your baby's doing, and also nibbling at the breast, because
Jack Newman's got them, hasn't he?
Be a bit careful when you're doing a YouTube thing with those sort of nibbling at the breast. You don't quite know what you'll get, but yeah, Jack Newman is very good. And that's Breastfeeding Inc. He's a Canadian paediatrician, and he does lots of short videos on babies that are feeding well and not feeding well, and he shows you how to do breast compressions and things.
Well worth looking at Jack Newman.
And Kelly Mom is also a very good website, American but very good. And that will show you lots of information on that. And also Global Health videos are very helpful as well. Global Health Media.
Yeah, they're superb.
They do some really, really good videos, and celebrating black breastfeeding. There is lots of black breastfeeding on there of mums in all sorts of countries and places. It's not all about middle class Western world. It's about just basic breastfeeding and managing normal. So look at all those videos. They're really good resources, really helpful.
I think the thing to say as well is that we do get nibbling toward the end of a feed. So we talk about the profile of a feed. So baby goes chomp, chomp, chomp to get the milk coming. And then, as Naomi said, they go into this big, deep sucks with swallows, And then they get to that chocolate pudding with a teaspoon point at the end where they've had the main course. And then you will get these little nibbly ones and then a long gap, a little nibble, long gap, little nibble, long gap. Well, as long as they've done that main part in the middle where they've done those really big sucks with swallows, that you can hear them swallowing, that they're really removing the milk, those little ones at the end are the chocolate pudding with a teaspoon, and that's fine. That's part of the feed, and we're not worried about that. What we're worried about are the babies that do the nibbly bit the whole way through.
They've got to play through the whole cycle in order. I'm just trying to see if we've got a picture of it, but we haven't.
No, we haven't on this one. No.
Yeah.
Not this week. We'll do it next week.
Yeah.
So, okay, Christina, I hope that answers your question. So Laura has come up. She's saying thank you for running these sessions. She says
we love them.
She says we're amazing.
We love doing it. It's great.
It's quite funny when you meet people and they go, "You're Alex" or "You're Naomi." We're like, "Oh, they know us."
I recognise your voice.
My 3-week-old is doing really well with breastfeeding and loves to cluster feed. We've worked hard to make sure that he has a good latch. I've learnt my lessons last time, and she's got very engorged when her milk came in, and it took a couple of days to clear. It does sometimes. I know it's tough. I find that I still feel a little bruised sometimes, and when he's feeding, it can pull right through into the back and can be rather uncomfortable. Do you have any tips to help reduce this? Also, I find spontaneous letdown to be a bit itchy. Other than replace breast pads frequently, is there anything else to help? Yes, I mean, I have heard tell that when you're getting a letdown, you can sort of put pressure on the sides of the breast. Some people have said that. Letdown's really interesting because we're all different. Some people don't feel their letdowns at all.
I think most people don't feel it, do they?
I certainly did.
I certainly did.
I certainly knew when it was happening, and I think I would describe it as the feeling of a sneeze because the whole body tingled. So obviously you do feel yours too.
Some people get overwhelmed with doom and gloom when they have a letdown.
Like a real melancholy, don't they?
But some people really feel very down and gloomy when they get their letdown and they find struggling
really
a lot.
Tough.
So it is a very strange sensation for every person individually.
Yeah. It's a letdown of oxytocin that's happening. So talking about the letdown, I don't know that we can do much to help apart from you having to change your pads, your breast pads.
Is your attachment deep enough? Make sure that your baby's on the breast really well, so that you haven't got that oversupply. You talked about that last time. Dumping it down a bit, because that will regulate itself if you start to remove the milk correctly, and it will lower the supply. I mean, some women just genuinely produce more milk than others, and the breast capacity in some women is different to other women, and it's not always directly related to breast size. So you might, it might be just that your breast capacity is quite large, and so that's why you've got lots of milk in your breast. But it could be that your attachment's not quite right, and if it's your second or subsequent babies, you might be feeding a toddler or remembering how you breastfed when you finished breastfeeding last time, and go back to basics this time. Make sure that you're really, going through the correct position and attachment for a newborn baby, not for an older baby where you're plonking them on, because sometimes they are sort of hanging on the end of it and lying somewhere across here. And actually remember to tuck your baby well in. All the principles of basic feeding: tuck them close, look at the way that your breast is dangling, line the nose up to the nipple, and take your baby from the shoulders up onto the breast, so that don't let them help themselves, because they will start suckling closer to the end of the nipple than you would need to have them in order to remove the right amount of milk. And so you have to support them by firmly taking them up onto the breast from their shoulders. And if you will not support your baby from here, if you go from the shoulders, your baby will automatically lift its arms back and its chin up. If you go from the head, they will automatically nosedive onto the breast. So make sure that you're giving your baby opportunity to move its body out and open its shoulders out, and its chin can go up, and then they can attach to the breast in the correct way, and that makes all the difference, just by not pushing their head forward and nosediving. And that's what a lot of parents do wrong, is that they push the head first, and actually it's the heel of your hand on the back of the shoulder blades that creates that baby, to open up and lift its chin up, so it can then lead with its chin and milk the breast from underneath.
So good luck with that, Laura. Hope it all gets a bit better. But well done for getting through the engorgement. That's really brilliant. Christina's come on to say, is it okay not to talk to her baby during the night? To trying to make a difference between day and night. Absolutely.
No games, no fun.
No,
tell your partner not to play games with him either.
Limit the stimulation at night, and you know, when you can, if the baby's not actually dirty, then you don't always need to change the nappy. So the nappies these days, if you're using the disposable ones, are great because they wick the moisture away. So if the baby's only wet, you can leave that wet nappy on. If they're dirty, you'll need to change them. But yes, get the stimulation right down at night, and they will begin to learn. They don't reckon they've got any idea of the difference between day and night till at least 6 weeks. But you can start the process.
Keep the lights low. Minimal laughing and playing.
Lygia's written to us. She says her baby's 1 week old and has got green poos. He's been super fuzzy and crying so badly. Can it be because of the pain meds I'm taking because of my cesarean? Also, and she's got also with a little diarrhea. So it's probably, your baby's only 1 week old.
What was the weight loss on day 5?
Yeah.
Was it okay? Did your baby reach its milestones and lessen?
Yeah.
About 8-10% of its birth weight on day 5. That's the first thing.
So see how you get on. It depends what medications you're on. If you're on the standard ones, things like ibuprofen, paracetamol, then that shouldn't be having any impact at all. That would be that they are very safe with breastfeeding and everything. It depends if you're on something else.
Sometimes babies have lots and lots of milk when the milk comes in on day 5, and they get lots and lots and lots of lactose, and that makes their poos quite explosive and green, and then the volumes go down. Sometimes it's because they're not getting enough milk. So you've got to look at what happened on day 5 and see if everything was okay on that day. And if the weight loss was normal, then it's maybe that you've just got lots of milk and it's settling down, and that will settle down. It's difficult to say without having a conversation with you. So I'm hoping that you're seeing your midwife again soon, but you could have a conversation with your own midwives, and then you know, perhaps she can advise you. And if you're still struggling, you could have a conversation with us or ABS.
See how you're getting on. It's
but
very,
make sure your baby's gaining enough weight.
Yeah, it's very early days. When you say your baby's only a week old, I mean they're just getting to grips with being born at the moment, and we've got lots of room to get things to be really good. I would say hello to Debbie. Debbie Wells and I trained together, and she's watching. So it's nice to see you, Debbie. Christine's come back. She says I think her baby's doing more nibbling than effective feeding. I never hear the sucking. So it's the swallowing you should be listening out for, and it's a really, as Naomi does a good impression, and I'll let her do it again. So it's just so funny. You'll see the jaw go, and then you'll hear it. Yeah, and you'll often see the jaw go slightly deeper. It'll be suck, and then slightly deeper, and it makes a little noise. So that's just telling you that they've swallowed. But have a watch and see what happens. But
if your baby's gaining enough weight and doing all the things that it should be doing, then it's probably right. If your baby isn't, then it probably isn't right.
Yeah.
But you know, if everything is okay and your baby looks like it's developing normally and peeing and pooing appropriately, and its clothes are growing, growing out of clothes and things like that, and looking a bit more chunky, then it's probably absolutely right. And not everybody makes lots of noise. Not every baby makes lots of noise when it feeds. Some are very subtle, and not everybody has gallons of milk, so they aren't there glugging and making those noises. So it might be that you've just got the right amount of milk, not too much, and then that's not so obvious. Get somebody to watch you.
I'm just going back through everything to make sure we've answered all the questions, because they were packing up. They were getting a bit stacked up there, but I think we've done them all. If you think I've missed anything, then let us know. Sorry, I'm sitting here looking at the computer. I hate it when we've missed them. On occasions we've missed a question and we feel so bad afterwards that it's very difficult to go back because we don't have an account that we can go back on Facebook, do you? But so do let us know if we've missed anything.
Was there anything else we were going to talk about? We did think about something else. I did write some things down, but I'm not sure I wrote down what I was going to say, so I've forgotten. I mean, we could talk about baby friendly a little bit more.
Yeah, I think again. I mean we've mentioned baby friendly a few times. Oh, Christina's come back and said thank you. But we have got more. Is it? we have got another question. Nikki's come through. We'll talk about baby friendly in a second. So her baby's now 3 weeks old, born at 6 weeks early and was tube fed with express breast milk for 2 weeks. Well done you. She's now exclusively breastfed with the aid of a nipple shield. I found when I was expressing I was producing more than she needed. I feel she struggled feeding when not in the laid back feeding position. Could the flow be too much for her? How would I go about weaning her off the shield? Thank you.
Challenge them.
Yeah,
I think, you know, they do it in their own time, and I wouldn't get too stressed about it if she's gaining weight okay, and you know, the feeds are pleasant for her and you. I wouldn't worry too much about it, because you'll get stressed if you're trying to do it, and she will get stressed if you're trying to do it. So I think that don't do it too quickly. You could look at giving her a little bit of food so that she's got the flow in the nipple shield and got the first bit of the letdown, so the violence of the flow is stemmed a little bit. And then you could whisk the nipple shield off while she's absolutely in the position where she's feeding. Whisk the shield off. I usually tell people to bung it up there and just put them back on in the same breath. So you literally pull it out of their mouth and put them back on without them realising. And often they're so busy suckling that they go straight back onto the breast and suckle without worrying, and they get flow because the flow is there, and they used to, you know, the milk will come with the next suckle, and they'll think, oh, that's okay, I'm still getting milk, and they will carry on feeding. So it's a question of timing that so that you don't do it too soon and not doing it too late so that they won't go back on the breast if you disturb them. So you know, it's normally a few minutes into the feed you can try it, but don't do it when your breasts are really full or you've just had a strong letdown. Just wait for that to pass. And just keep challenging it, you know. Just do it when they're maybe a bit sleepy, a bit laid back. You know, try feeding your baby while they are in a sort of a dreamy state, because that often is unconscious feeding, and they'll do that without thinking about whether there's a nipple shield there or not. And just, if it doesn't work, just go back to the shield, give them their present back, you know, give them that reward, give them the nipple shield back, and then try again another time. But don't stress.
It's keeping the breast as a positive place, so not forcing the baby to do something, because actually you always want them to associate being at the breast as something nice. The thing with shields is that we do know that it's within it's the baby's got the power when the shield is there, so they will decide when they're prepared to give up using a shield. So it's totally up to your baby.
And some babies breastfeed for a year with a nipple shield on.
That's fine, as long as they're transferring milk. Exactly. It's just one more thing to carry, isn't it? It's one more thing to have clean.
And they will do it. They will do it, but it might be at 8 weeks. It might be at, you know, it might be today. It might be tomorrow. You don't know.
It's when they're ready.
But so just don't stress.
Don't force it, because that really will make it more of an issue. So, good luck with that.
You might find that you do one feed and you think, great, we've cracked it, and then you can't get them to feed without it again. Go back to it another time. Just make it fun.
I think you've got to look how far you've come, Nikki. Your baby was 6 weeks early. You've done an amazing job, and you've got this baby that's fully breastfed. It's absolutely incredible. It's a total credit to you. So and hopefully she'll help you, and she'll let you take the shields off soon. That would be nice, wouldn't it? Good luck with that. Francesca said her baby's 15 weeks, and she noticed last week that her breasts don't feel as full anymore. Does this mean my supply's dropped? Or that she's getting what she needs, so not producing too much? That's exactly what's happening. So
you've regulated your flow. You've become autocrine rather than endocrine system.
So your body's not going to waste time making milk that's not needed. So the body's worked out how much milk your baby needs, and it's not going to produce any more than you actually need. So it's conserving energy. It's good on your body, really. It's
a funny feeling though when you're used to being full, isn't it? You suddenly do think you've lost your milk. But you know, at sort of at 12, 13 weeks, your baby has a huge growth spurt anyway, and lots of stimulation, and the milk production is stepped up. But not just the production, the composition of the milk is stepped up. So with the frequency of the feeding, telling your breasts that they need a different type of milk, the flow will get bigger. But then once the composition has sorted itself out, the supply will go down, but the composition of the milk is increased. So they get different components in the breast milk that they didn't have before. And that might be that there's more fats, or there's more other things that haven't got the same volume, and the supply will damp down. But your bras start feeling funny, don't they, and a bit too big, and that's all. It all sounds good if your baby's reaching its milestones.
That's fabulous. So We've had a nice heart from Lygia, which is very lovely of her, and Nikki Edmonds has come back and said thank you very much, much appreciated. So we're just going to finish, I think, with a quick chat about BFI, Baby Friendly Initiative, which is a UNICEF initiative which we've mentioned a number of times before. It's all hospitals in the UK are going towards it, working towards it. We've been working towards it for about 5 years now. And it's a staged approach. There are 3 stages. We've got stage 2 already, so 1, 2, and now we've got 3 to go for. And we're going for stage 3 in December time at the moment. It looks like it's going to be. And you may be playing part of this, depending on when, if you haven't had your babies yet, you might be part of it. So mums who are having their babies in the autumn might be interviewed by the Baby Friendly Initiative. You'll be asked for your permission to do this. We will ask you in advance, are you prepared to be interviewed by Baby Friendly? And what they're looking for is to find out, what have we taught you? What have we as a hospital, we as a team taught you all? And they want to know that we've told you about how important it is to do skin to skin when your baby is first born, and we have talked about that over and over again because it's exactly where the baby expects to be. We talk about the importance of letting the baby feed when they want to feed. We've talked about responsive feeding today. How to position and attach a baby, and that's what we've talked about a lot. And all the things we've covered today are the questions that they will ask anybody who's prepared to be interviewed. They'll ask, have you been taught this? Was it explained to you? Do you understand that your baby wants to be responsibly fed? And if you're giving bottles, this is how you do it.
Why is giving breast milk better than better for your baby? Things like that. So your midwife should be talking about those things with you in your pregnancy at some point. And if you don't get a conversation, ask for some more information about it, and have a two-way conversation with your midwife as well. So that you can inform yourselves about it and look at the Baby Friendly website. Yeah,
have a look. There's some great resources. We've signposted people there to that website from this session before. There's some fabulous resources on the Baby Friendly website. So UNICEF Baby Friendly Initiative, BFI, not the British film industry. So we've just got back, Nikki's come back and said thank you. Francesca's come back and said she's feeling really reassured, which is nice. And Imi has come back, said her little boy was tongue tied, it's been snipped, he's getting frustrated with feeding. I think she's recommendating. So not sure if you're asking for some help there. He's getting frustrated with feeding. So I think it's if you're struggling with the feeding, it's just try and keep it as positive as possible, as we've just mentioned. If he's getting upset, do something else. Find it if you try the other side, try a different position. All those things can make a really big difference. We find upright and laid back positions are really good for babies because they're in charge, whereas when they're in a cross-caudal position where they're held like this, you're in charge. But in those upright positions where the baby's here, he may prefer to do that. See how you get on.
When did he have it done?
I don't know. No,
I mean, if he's only just had it done, he will get worse before he gets better.
Yeah.
Because the muscles that he has been using will have been stopped working, and the new muscles that he needs to use will be kicking in, and he will be in no man's land. He will be saying, I don't know what I'm doing, where's my tongue, what am I supposed to do? And it will be little feeds. But also, it's a bit like when you start doing running, you can only run for about 2 steps, and then you have to walk, and your baby's tongue will fatigue very quickly when it's not used those muscles. So they will fall off and fall asleep and feed frequently at this point because they struggle a little bit, and it's relearning. So don't expect too much from your baby immediately. It depends when it was done, but it gets better, but it could take up to a month to get to the improvement, and there will be good days and bad days. Make sure your position and attachment is really good, because if it wasn't great before, it's not going to cutting a tongue tie on its own will not make it magic wand. You will still have problems. So you need to be working on your positioning and attachment all the time. And obviously your baby's mouth shape will have changed because the tongue tie has been cut. So the way that you offer the breast might be slightly different this time. So seek advice if you're still struggling. It's never a magic wand when you have a tongue tie cut. So make sure you get ongoing help.
Got another message. She's called, it was a lady called Flipa. She says, hello lovely ladies, my little one is 3 weeks old and he's suffering a lot with colic pain. I'm also using nipple shields. Can that lead to worsening colic pain? Many thanks. It was to do with how the baby removes the milk from the breast. It's really crucial. It goes back to what we've just said about positioning and attachment. If a baby doesn't go on as well as they can do, they do get that more sugar laden lactose first part of the milk, and that is why you'll end up with a baby that's colicky. And Naomi mentioned it earlier on, that actually you end up with this sort of situation where it brings in a lot of gas into the stomach. There's like it's literally fermenting, and that's why babies feel so uncomfortable. Looking at your positioning attachment is the first thing you would do with this again. The nipple shields themselves aren't going to be causing the problem, but I think it's making sure that you've got as good a positioning and attachment even with a nipple shield as you can. Trying compressions might help too, because you're going to be helping push that milk into your baby. That will give her a better balance. Just seeing how you get on. But the shields themselves aren't necessarily what's going to be causing the problem, but I would look at the positioning and attachment again, please, Felipe.
Get someone to support you.
Yeah. So you know where we are if you need us, but there's OBS and Latch, so there's plenty of support
Baby
out
cafe,
about. Abingdon Baby
and
Cafe.
I think to open up a little bit now as well, so it may be that there are places where you can go to get breastfeeding help, with your Huffers to drop-ins and things. They may be starting up in the next few weeks, so hopefully there's some places that you can go local to you, which is really important, not having to trek everywhere a long way and coming into a hospital. You want to be local to you if you can be. Yeah.
So good luck with that, Felipe.
Well, I think we're well over time.
We are now over time, with 5 minutes over time, but we've had some fabulous questions.
We have, and it's been lovely talking to you.
So we'll sign off and we'll see you next week. It's us two again, isn't it?
Yeah.
So it'll be the two of us.
Yeah.
So all the best. Think about your questions between now and then. And I'm trying to remember the name of the lovely lady who should have had her baby by then. Who was it?
Let us know how you got on.
Yeah. So see if I can find it. It was Becky. So, oh no, it was not Becky. No, it was not. See if we can find her and wish her all the best.
Anyway, we'll see you all next week. So you know how to contact us. I think the details are underneath on the feed, so you've got access. And don't forget that all of the Oxfordshire Maternity Voices Partnership videos are on a YouTube channel, so you can see all the questions and answers from us and also from Ask the Midwives as well and other sessions. So there's lots of information for you to have on those website, on that channel. Okay, so we'll talk to you next week. Thanks for joining us.
Thank you.
Bye now.